So with Rare Disease Day coming up, I think that whole concept of a Rare Disease Day makes the case for the relevance and the importance of an organization like the Muscular Dystrophy Association, ALS, pairing, right? So bringing together patients who in and of themselves have a disease that might be very rare, but might have direct relevance either clinically or scientifically to some of these other rare diseases. So that kind of by banding together, we can understand the commonalities, the similarities, and the shared mechanisms um, in order to be able to develop drugs more effectively to treat them. So there are rare forms of ALS that are caused by genes. Some of the more common genes I would, are rare overall, but not that rare in ALS. So mutations in the C9orf72 gene could explain as much, in depending on the population, 20% of ALS. Mutations in SOD1 probably explain less than 2%. And then from there on, each individual gene explains a smaller and smaller fraction until we're down to some genes that might only be causing ALS in a single family that we know of in the world so far. And I think one thing that's exciting is that N of one studies, like basically the ability to develop a targeted molecular therapy that attacks the gene that's mutated, but potentially only in a single individual or a single family where there isn't really commercial viability, is now on the radar and possible. So here at Columbia, um, our center is very involved in a project called Silence ALS, where we develop antisense oligonucleotides for these very, very rare ALS gene mutations with the hope of bringing those as therapy, almost precision medicine therapies, customized therapies to people with these very specific disease genes, which